All right, good to have you back. Now back to one of our top stories. Phase 2 of South Africa's COVID-19 vaccination campaign gets underway today. Business for South Africa has pledged its continued support for the vaccine drive, and it says it will provide 13 private sites capable of administering 3,500 vaccines a day, and it hopes to increase capacity next week to 22,000 vaccines a day. Chairperson Martin Kingston speaks to us right now about all this and more. Martin, good to have you, and good morning to you. Now, let's talk about some of the interventions that you are tabling at this point.
Well, good morning to you, Tamila, and to your viewers. We've been working hand in glove with government since the beginning of this year on developing the rollout of the vaccination program. Obviously, it's overseen by government, particularly by the National Department of Health at a national but also provincial level. We've had teams that have been supporting them, doing everything from the procurement of the vaccine through to the distribution and, of course, the assembly of the sites themselves. And importantly, the registration system, EVDS, which is up and running and has been taking registrations for over 60-year-olds now for about 4 weeks. And as you said, we've got 13 sites that are actually online from today, starting to vaccinate, particularly healthcare workers. And then they will be allocated people who should be vaccinated by EVDS, both in the public and the private sector. And then ramping up as quickly as possible, we believe we're going to be able to get to approximately 40 sites by the end of this week, 80 sites by the end of next week. And as you said, that should take us to about 22,000 vaccines per day. And ultimately, we think that we're going to have well over 1,000 sites in the private sector working on an integrated basis, as the Minister said last night, with the public sector. It's got to be completely integrated to ensure that everybody can be vaccinated as quickly as possible, starting most importantly with the balance of the healthcare workers and then those that are over 60, because we need to ensure that they're vaccinated, if possible, before the onset of winter and the third wave.
Yeah, and I suppose the success of the vaccination rollout program also depends or relies on more awareness around EVDS, as well as people actually registering on the system. Are you satisfied with the amount of South Africans that have registered? Are you satisfied at the speed and the sense of urgency with which registrations are currently taking place?
No, we're not satisfied. I think I speak for everybody when I say that. We've got about 2 million people, half of those healthcare workers and the balance over 60 who've registered to date. If we bear in mind that there are over 5.5 million people who are over 60 in the country, they need to be registered so that they can receive their vaccines. There are many different ways in which people can be registered, and we're committed to encouraging everybody to assist those who may not have easy access to EVDS, either by phone, by their laptop or computer, even to be able to go and walk in, although we're discouraging walk-in at this stage because we think it will clog up the system, and it's very important to schedule vaccination. So these are teething problems that are bound to happen at the outset. I'm sure that when we speak in a couple of weeks' time, many of them will have been ironed out, will have increased very substantially the number of people who've been registered. We need to try and register as many of our 40 million adults as possible so we can vaccinate them all, ideally before the end of this year. We've got enough vaccines to be able to do that, and we'll certainly have enough capacity in the public and private sector. But as we've seen around the world, the important thing is to vaccinate everybody as quickly as possible.
Yeah, and with that being said, remind me of what the health minister had said, that unfortunately they had a target that they wanted to reach at least this year, but saying that that has been pushed back to at least the first quarter of 2022. What do you think they can do, just in terms of advice, with regards to speediating this process? As you mentioned, we need to get as many people vaccinated this year as much as possible.
Yes, so we're in daily contact with the National Department of Health. They are overseeing the entire process, as I mentioned earlier. The only way that we can really accelerate the process is not by accessing the vaccine. We now have the vaccine. Obviously, we'll be administering Pfizer from today, although we hope that the J&J vaccines that have been produced by Aspen will be released urgently. There's over 1 million that have already been manufactured. So there's no constraint on the vaccines. If we bring sites online as quickly as possible, and as I said, we will see a very aggressive ramp up over the next 2 or 3 weeks, and we're able to register as many people as possible. We see no reason why the over 60s shouldn't be vaccinated before winter, and we see no reason why we shouldn't have vaccinated the vast majority of the population, not by the first quarter of next year, but indeed by the end of this year. That is our goal, and we're committed to working with government to achieve that objective.
All right, we'll leave it there. Martin Kingston, thank you so much for your time, the chairperson of business.